Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Hypothermia. Introduction. Hypothermia happens when your body cannot keep itself warm enough. The drop in body temperature may lead to organ failure. This can be life-threatening. This program explains hypothermia. It includes information on its symptoms, causes, treatment, and prevention. Hypothermia. Hypothermia happens when the body's temperature drops below 95 degrees Fahrenheit, 35 degrees Celsius. Normal body temperature is about 98.6 degrees Fahrenheit, 37 degrees Celsius. In cold environments, the body tries to warm itself by shivering. After a while, the body gets worn out and can't keep itself warm. Exposure to a cold, dry environment can cause hypothermia within hours. In cold water, hypothermia can develop within minutes. In some cases, hypothermia happens because of a disease that makes it hard for the body to stay warm. This is called secondary hypothermia. In these cases, hypothermia can develop even when the weather isn't cold. Examples of such diseases include certain skin disorders, stroke or injury to the spinal cord, problems with low blood sugar. Symptoms. Shivering is a key indicator of hypothermia. Other signs and symptoms include problems with coordination or clumsiness, confusion or difficulty thinking, trouble reasoning and making good decisions, mumbling or having trouble speaking clearly, stumbling. Other signs and symptoms of hypothermia are being unconscious, weak pulse, breathing that is shallow or slow, sleepiness or lack of energy, lack of concern about one's condition. The symptoms of hypothermia can come on slowly. Because hypothermia affects a person's thinking, they may not realize they are in danger or that they need help. Other cold weather injuries that can develop include chilblains, frostbite, gangrene, trench foot, also known as immersion foot. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Hypothermia usually happens in cold weather or after exposure to cold water. Other risk factors for hypothermia include alcohol or drug use, mental illness or dementia, some medications, other health conditions. Alcohol and drugs affect your judgment. People under the influence of alcohol or drugs often make unsafe decisions related to the cold. Alcohol may make the body feel warm, but it actually makes a person lose body heat faster. People with mental illnesses and conditions such as dementia can also make unsafe decisions. They may not dress appropriately for the weather or realize that they are in danger. They could wander from home and become lost or stranded. Some medications make it harder to keep the body's temperature within a normal range. These include some sedatives, antidepressants, antipsychotics. Certain health problems can make it harder for your body to regulate its temperature. These can include burns, dehydration, nerve damage and other disorders that affect sensation, Parkinson's disease, poor nutrition, severe arthritis, stroke. Examples of other situations that can lead to hypothermia include accidents that involve falls into water, such as boating accidents, not being able to remove wet clothes and go somewhere warmer, wearing clothing that doesn't keep you warm enough. Babies and the elderly are especially at risk for hypothermia because their bodies have a harder time staying warm. Seniors also have a harder time sensing the cold. In these cases, hypothermia may happen if the air conditioning is too cold, the heating system is not working well. Diagnosis. Your healthcare provider will perform a physical exam. He or she may check your temperature and perform blood tests. He or she may also use an electrocardiogram or EKG to look at the electrical activity of the heart. Treatment. Get medical help right away if you see someone with signs of hypothermia. If possible, move the person indoors, remove any wet clothing, and cover the person with blankets. If you can't move the person inside, try to keep him out of the wind. Never use a radiator, hot water, or other sources of heat to warm the person. This could burn the skin and can lead to irregular heartbeats and death. Never massage the legs or arms, as this can force cold blood back to the heart. If the person is able, give them warm liquids without alcohol or caffeine to drink. Emergency medical care is often needed to raise the body temperature. Treatments for severe hypothermia may include blood rewarming, airway rewarming, irrigation. Prevention. There are steps you can take to avoid hypothermia. Before you spend time in cold conditions, make sure you understand the potential dangers and plan accordingly. To avoid hypothermia, dress in layers of loose clothing. Try to keep your body dry in cold weather by avoiding outdoor activities that make you sweat. Don't drink alcohol on cold nights before bed when you are outdoors or when you are on a boat. Wear a life jacket if you are near or in water. If you fall in the water, keep your clothing on until you get to a dry place. If you are in the water with others, huddle together facing each other. In water, lift your knees in close to your chest. If your life jacket keeps your face down, press your legs together, cross your arms, and lift your head backwards. When dressing babies and young children in cold weather, give them one extra layer than an adult would need. Limit the amount of time children spend outside in the cold, and take breaks inside often. To protect the elderly, keep the temperature in their homes above 70 degrees Fahrenheit, 21.1 degrees Celsius.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Hypothermia happens when your body cannot keep itself warm enough. The drop in body temperature may lead to organ failure. This can be life-threatening. Hypothermia usually happens in cold weather or after exposure to cold water. Other risk factors for hypothermia include alcohol or drug use, mental illness or dementia, some medications, other health conditions. Shivering is a key indicator of hypothermia. Other signs and symptoms include problems with coordination or clumsiness, confusion or difficulty thinking, trouble reasoning and making good decisions, mumbling or having trouble speaking clearly, stumbling. Because hypothermia affects a person's thinking, they may not realize they are in danger or that they need help. There are steps you can take to avoid hypothermia. Before you spend time in cold conditions, make sure you understand the potential dangers and plan accordingly. To avoid hypothermia, dress in layers of loose clothing. Try to keep your body dry in cold weather by avoiding outdoor activities that make you sweat. Don't drink alcohol on cold nights before bed when you are outdoors or when you are on a boat. Thank you for using Explain.